Hello, I'm Pam Hyde, Administrator of the Substance Abuse and Mental Health Services Administration, or SAMHSA. SAMHSA's mission is to reduce the impact of substance abuse and mental illness on America's communities. Suicide prevention is one of SAMHSA's highest priorities, and SAMHSA is proud to support efforts such as the National Action Alliance on Suicide Prevention, a public-private partnership with more than 200 participating organizations. We're also proud to have worked with the United States Surgeon General to create the National Strategy on Suicide Prevention, one of only 28 countries to have such a plan. Last month, our President announced 19 action steps to increase access to mental health services for our veterans. And just this past Monday, I was privileged to participate in a mental health and suicide prevention event at the White House, in which the President's domestic policy staff, along with representatives from several federal, military, and civilian departments, provided stakeholders and veteran service organizations with updates about our federal grants and other national efforts to improve access to mental health services and prevent suicide. This kind of high-level attention to these issues is a game changer for us here in the U.S. Although I could not be with you in person, I wanted you to know how important the work is that you'll be doing today. It's critical for suicide prevention to be a health and safety priority in the workplace. And it's critical that people know, lay and professional alike, that suicide is a preventable public health issue. I know how much our Canadian colleagues are doing in this arena, so I am pleased to know you all will have the opportunity to learn from each other about these approaches to these issues across North America. You will probably hear several times today that in 2011, the most recent year for which we have national information, 39,500 people died by suicide in the United States. 2 weeks ago, SAMHSA released 2013 data from the National Survey on Drug Use and Health. This survey provides mental health data as well. From that survey, we estimate that 9.3 million adults aged 18 or older had serious thoughts of suicide in the past year. 2.7 million made suicide plans, and 1.3 million adults attempted suicide. In addition, estimates from other sources tell us that at least 2.5 million high school students in 9th through 12th grades had serious thoughts of suicide. I suspect the numbers in Canada are similar. The recently released World Health Organization report says there may be as many as 20 attempts for every death by suicide worldwide. These attempts and serious thoughts of suicide represent a lot of mental and emotional distress that needs attention if we're going to reduce the number of deaths from a public health issue that's just as critical as clean drinking water and just as urgent as vaccinations for infectious diseases. Our U.S. data also tell us that in 2011, more than 70% of the suicides in the U.S. took place among adults between the ages of 25 and 64. Suicide is the second leading cause of death for people ages 25 to 34, and the fourth leading cause of death for individuals 35 to 54. This means that this issue is present in the workplace every day. Every death by suicide profoundly affects family, friends, co-workers, and the community as a whole. The safety and productivity of the workplace depends on each of our nation's ability to effectively address mental health and substance abuse issues among workers. We need to work together to ensure that workplace programs addressing these issues are actively promoted and widely utilized. This summer, SAMHSA, along with the Federal Office of Personnel Management, sent fact sheets to every federal department and worker in the nation to raise awareness about the importance of workers' mental health and to support those with mental health challenges to get the help they need. What this means is the U.S. federal government as an employer is trying to model good practices to educate workers on the basics of mental health and signs of distress, including suicide warning signs, to decrease worker concerns associated with seeking help, and to enhance emotional health through social connectedness, resilience, and improved problem-solving skills. I am most proud of these efforts. Our two nations, Canada and the United States, have a long history of working together and a shared commitment to suicide prevention. We worked together on the recent WHO report and will continue to collaborate going forward. Today you will hear workforce representatives from the military, from the corporate world, from professional sports, and from suicide attempt survivors, all working to prevent suicide and promote behavioral health in all kinds of workplaces. Best wishes for a wonderfully productive meeting and the inspiration to take your experiences into your own workplace to provide for the health and safety of workers everywhere.